Welcome to the Beverly Hills Plastic Surgery Podcast. In our ongoing series of Plastic Surgery 101s, I am here today to discuss with you liposuction with the most knowledgeable and skilled plastic surgeon for liposuction that I know, Dr. Millicent Ravello.
Well, hello. How are you?
You've liposucked more than I have in your career.
Yes.
In terms of actual square footage and poundage, I can't get over the cases
that might
you do.
be true. In fact, I think Dr. Snibby says thank you because I have now liposuction my right shoulder into oblivion. I am now getting regular steroid injections.
It is a physically demanding specialty for us, but for our patients, there's a lot to know.
There's a lot. And I think it's very appropriate that we are doing this particular podcast 2 days after Thanksgiving when everyone in the country is going, oh, could use some liposuction.
and we're here to help.
And we're here to help. So yes, you could do a juice cleanse, or you could just come to us and you could have some liposuction.
Or both, which is the best combo.
All right, so what is liposuction? Liposuction at its core is exactly what it sounds like. You are using a suction device to remove fat, otherwise known as lipodystrophy or, whatever. Lipus, it refers to fat.
It's fat you don't like.
Fat you don't like. And it is a very powerful, very useful technique to remove fat. I mean, it does an excellent job at what it's supposed to do. That's not the tricky part. The tricky part is what areas to liposuction, who's a candidate for liposuction, and what realistically can you achieve with the liposuction.
Right. And a frequently asked question is liposuction a good method of weight loss?
Not weight loss. So this is the perfect liposuction candidate. Let's start with that. Ideally, it would be someone who's an otherwise normalish weight, maybe a little bit overweight, normal for them, maybe a little bit, BMI up to 30, something like that is otherwise healthy, motivated to eat relatively healthy and work out, but still has these areas of fat, stubborn fat is what they're called, that they just can't lose no matter how well they eat or how much they exercise. That is the perfect candidate for liposuction because they're already doing everything right and they just can't get rid of these stubborn fat areas.
BMI, body mass index, it's basically your height versus your weight. And like for somebody like me, I'm like a 27. And 27 is like, you're kind of overweight. You should be like 25 or less is normal weight. 30 is like, you're starting to get into like
obesity.
Whoa.
Yeah.
That's too much.
So normal-ish to a little overweight is a good candidate. On the opposite,
so far I'm in.
So you're in. You're good. You're all set.
Okay.
On the opposite end of that spectrum is the person that comes in with a BMI of 40 and isn't really eating right and is definitely not exercising and is trying to use liposuction as a weight loss technique. No.
Doesn't work.
That's not the option. Liposuction will reshape you. It will get rid of those unwanted areas of fat, but you probably won't see much of a change on the scale. What you will just see is an overall change in your size and shape. You may see your pant size go down, but you probably won't see a big number change on the scale.
Yeah, and really I think of liposuction as a way of contouring areas that are not your favorite.
Right.
Love handles, abdomen, bra fat, saddlebags.
Yes.
I hate sucking medial thighs. I hate it. They sag. They're difficult.
Right.
For all you people out there who are like, I'm going to get my medial thighs done. It just not so fast. Let's talk about it.
You really have to have a really juicy fat pad on the inside of your thighs for me to go after it because that is a rough place so let's talk about the other thing that goes along with liposuction is skin quality, because your skin has different tightness levels and elasticity in various areas of your body. And on the inner thighs, the medial thighs, that is probably some of the thinnest skin in the body. And when you suction the volume out of it, when you take the fat out, it just does not snap back like skin elsewhere in the body might. And so then you get these like saggy skin areas. And now you're like in a medial thigh lift category where we're talking about cutting out skin and putting scars on your inner thighs. So if I do medial thighs,